Start off right here, and this is not a good title to have, and that's why the Ministry of Health is tonight putting on notice institutions and health workers moving vaccines to unauthorized centers, saying they are putting the lives of Kenyans at risk since most lack the required storage facilities. So during a briefing on the COVID-19 situation in the country, Kagwe said they had unmasked institutions that were defying government orders and that action will be taken against them. The CS spoke as the Ministry of Health disclosed that it was considering targeting vaccinations for the elderly to minimize the risk of contracting COVID-19 in the crowded vaccination centers. Chemutai Goin has more.
With over 2.8 million doses of AstraZeneca so far administered since the vaccination exercise began, 800,000 of these being Kenyans fully vaccinated, the government today alarmed by a discovery that some Kenyans are getting the jabs from unauthorized facilities.
There are no vaccinations that should take place outside the Ministry of Health designated vaccination approved sites and by persons approved by the Ministry of Health.
It is also warning of unauthorized vaccination centers that are issuing vaccines whose condition may not be known, thereby posing a health risk.
Some of the adverse effects of vaccines which have not been stored well include severe reactions to the vaccines, and some of them could lead to what we call anaphylaxis, and that could even end up in a death situation.
There is no way an individual around the country of whatever stature will have vaccines of their own unless they are stolen vaccines. Nobody knows what vaccines they are using. Nobody knows whether they are actual vaccines or whether it could be anything else that they are vaccinating with. It's a criminal offense.
The cabinet secretary seemingly angered by what he termed as politicization of the vaccination drives by politicians for their personal gain.
The Ministry of Health would therefore like to issue a very stern warning to any person with the intentions to pilfer vaccines from government facilities that will face the full force of the law.
To curb the vaccine theft,
a weekly county logistics report must forthwith be submitted outlining the doses received, doses used, dose balances, and the number of people vaccinated.
It also emerged that unscrupulous individuals and institutions were demanding payment for the administration of the vaccine, the ministry directing the Kenya Medical Pharmacists and Dentists Council to investigate complaints lodged.
Vaccines are not for sale in Kenya.
And as part of its plan to ensure that the most vulnerable stand to be counted, Dr. Willis Ahwale, who chairs the National Task Force on Vaccine Deployment, says they are considering targeted vaccinations for the elderly to minimize the risk of them contracting the virus from the populated vaccination centers.
We are going to use community health workers who will go to the villages, the elderly people, and get them listed so that they can be a targeted outreach that will be conducted close to them.
The elderly, particularly those with underlying conditions, advised to get the jab to lessen the effects of the virus if they contract it.
There is this misinformation that if you have hypertension or diabetes or cancer, the vaccine will make your situation worse. The truth of the matter is that more than anybody else, you need that vaccine because those are the conditions that will lead to death.
With daily new infections continuing to rise as the country battles the Delta variant of the COVID-19 disease, politicians were once again put on the radar for contributing to the rise in cases.
The political class of whatever level, that it is getting to a point where you are frustrating us as the Ministry of Health. We cannot have this nonsense of 3 steps forward and then we come back all the way to where we were before. We have no bed capacity. Our isolation facilities are full. And yet, people still continue.
With over 100,000 people listed as defaulters of the second dose, Dr. Ahwale gave a forewarning.
Some are saying, I'm waiting for Johnson & Johnson. I want to get Moderna or I want to get Pfizer. We are really telling them, AstraZeneca is also there insufficient. You need to get that second dose because we've not adopted the policy of mix and match yet.
In mid-September, the country will be receiving doses of Pfizer vaccine. This is a shot in the arm, even as it appears that Kenya's target of vaccinating half its population by the end of the year will not be met. Chemutai Goin, Citizen TV, Nairobi.